Okay, good evening, everyone. It's 5:30, and we will now begin the info session on healthcare resources. I'd like to introduce the HLA team who will be assistant tonight. Myself, Alicia Hilton. We also have Megan Munsard and Alex Strider. I would like to thank all the attendees for joining us tonight, and a special thanks to our presenters for volunteering their time to share educational and valuable healthcare information. I would just like to go over a couple housekeeping tips. If you could please turn off your cameras and mute your microphones unless you're presenting. Also, feel free to introduce yourself and share any resources in the chat. Each presentation will be about 15 minutes, so we will move smoothly from one to the next to respect everybody's time. And questions can be posted in the chat and will be addressed during the Q&A at the end of the presentation. Tonight's presentations will include Bay Pines. We'll have Miss Blossom Caper presenting that. We're also having the Recovery Epicenter Foundation with Mr. William Atkinson presenting. We've got the Pinellas County Department of Human Services. We've got Miss Dominique Randall. And lastly, we'll have West Care Florida Gulf Coast with David Hassett.
All right, welcome everyone. Thank you for being here tonight. Our first presenter is Blossom Capper. Blossom is the homeless program coordinator for Bay Pines VA healthcare system. Bay Pines is dedicated to improving the lives of veterans and their families, offer shelter contracts, transitional housing, and permanent supported housing interventions. Thank you for being here, Blossom. You can go on and get started whenever you're ready.
Hi, thank you guys for having me. Like Megan said, I'm Blossom Capper, and I'm going to go over a little bit about VA, but primarily VA homeless programs. And VA, primarily we're a medical center. A lot of people think, we have money for prevention, financial resources, things like that, but we really are a med center. And embedded with that and within that is our very large homeless programs. And then for our financial support, like prevention funds or deposits for people to move into housing, we really do lean on the community. And the reason we have such a large homeless programming is because I heard this quote a while ago and I love it. Housing is healthcare, right? So when someone has a home, they are healthier. They're physically more healthy. They're mentally more healthy. So housing is healthcare. Next slide. Just a little bit about me. My role here at Bay Pines, I am the homeless program coordinator and I supervise our outreach team. Next slide. So during this presentation, and you guys are probably pros at this part, so I'll fly through the first few slides. We'll define homelessness. Just want to tell you a little bit about our homeless programs, differentiate between them. That way, if anyone here ever runs across a homeless veteran, you know how to find us, what programs we offer. So we'll talk about referral process and our points of contact. Next slide. So just again, you guys are pros at this, so I'll get through these first few slides quickly. But we at VA define homelessness just as many of you all do, as HUD does. And we do treat all the categories of homelessness. So most of our programs serve those that are literally homeless. And you can go to the next slide. We also serve Cat 2 veterans. And those are our veterans that are with imminent risk. So it really depends on the program. And when I get into the programming, I will go more into that piece. Next slide. So I don't have Cat 3 on here, and that's honestly only because it's unaccompanied youth, and we do not encounter that many unaccompanied youth at VA. Of course, if we ever did, we would serve that person and that veteran. We do serve those fleeing and attempting domestic violence. We actually have a domestic violence coordinator here at Bay Pines. So she's a good subject matter expert for us when we do have someone who's both homeless and dealing with domestic violence or fleeing domestic violence. We work really closely together. Often she's making referrals into our program, and we're leaning on her for support and resources in the community and, screenings and things like that. Next slide. So what we have to offer, like I said, VA Medical Centers is huge. We offer primary care, mental health, inpatient mental health units, inpatient psych, inpatient substance treatment, inpatient PTSD treatment. And then, like I said, everything medical, primary care, we have specialty care, we have an oncology clinic, eye clinic, you name it, we have it at Bay Pines. And then, of course, my specialty within this is the Bay Pines homeless programs. Within that umbrella, we offer outreach services, contract emergency shelter. And what that means is, again, we aren't always the direct offer of services. We really lean on our community partners to go into contract with and grants with. So contract emergency shelter, we have several contracts with partners in the community: St. Vincent de Paul, Boley, Homeless Empowerment Project, PERC. I'm probably missing someone. I'm sorry if I'm missing someone. So we go into contract with them to provide shelter. They're actually the provider. It's on site with them. And then we oversee that contract, and we have a liaison that also doubles back and meets with the veterans also. We provide transitional housing in the same way. We call that grant and per diem. And that's programs within the community that have written grants and are receiving grant funding from VA to operate those programs. And then we have on-site clinical programming to eligible veterans, meaning a lot of the programs that I just went through: inpatient substance treatment, PTSD treatment. And then we do have an inpatient program that really it doesn't only take homeless, but it really tailors to our homeless population. It's called TRRC. You'll hear people call it the DOM, and it's basically a residential treatment program where if a veteran has a mental health diagnosis and is willing to check in inpatient, work both on their mental health, finding employment, finding housing, they can come on site to that program. And then one of our largest programs is our HUD-VASH program. That is our version of permanent supported housing. And I'll go more into later slides what that is. That's definitely a highlight of our homeless programs. And then we have so many other supports under the umbrella that I'll go through. So what we have to offer: outreach. We actually have 6 clinical social workers that are assigned to our team, 5 up here at Bay Pines. We cover the entire, what we call a catchment area. So we cover from up here all the way down to Naples and over into Sebring. So it's 9 counties. So for that, we have 5 people stationed up here at Bay Pines. One of the people at Bay Pines travels between here and Sarasota. She does tons of outreach in Sarasota. And then we have an outreach worker down in Lee. Our HCHV staff, which stands for Health Care for Homeless Veterans, also serves as the liaisons to the programs I talked about. Like I said, outreach. We're also, we answer a hotline. So it's a lot of, in-reach calls coming to us. So that NCCHV hotline, we use a lot of acronyms, and VA stands for National Call Center for Homeless Veterans. Veterans call. It lands at a mega center in New York, and then it's filtered down to us locally. That volume is pretty high. There's days we get 8, 9 calls a day. Some on a slower day might be 4 or 5. Those veterans that call are both homeless and at risk. So we serve them with the homeless resources, and we completely wrap around them. If we see they haven't seen a primary care physician or they have an upcoming mental health appointment, we do those reminders and we get them wrapped in. And then, like I said, we have tons of community partners, and a lot of our roles as outreach workers and VA social workers is really linking with those community partners and firming those up. Next slide. So ways we engage with homeless veterans and outreach. We do this, with our outreach workers going out in the community. They have a reoccurring schedule where they go to different sites. We go to, I'm sure most of you are familiar with these places. We go to Daystar. We have a transitional housing and contract shelter at St. Vincent de Paul, but we go to the care center side to make sure there's no one over there who maybe hasn't identified as a veteran. We go to the St. Vincent de Paul Soup Kitchen in Clearwater. We have a great relationship with Jewel at Safe Harbor where she's constantly referring. We're referring back and forth. We go to Pinellas Hope, the Shepherd Center in Tarpon Springs, and then we have a very strong relationship with HLA where we're referring back and forth and working collaboratively with veterans. At VA, we have what we call an unassigned walk-in clinic, meaning if a homeless veteran walks in, even if they're not receiving VA services or a VA primary care, they can walk in and see a social worker to address their homelessness. We also have, and this is huge, HPACT, which stands for, it's basically homeless primary care. So we have a primary care clinic, physician, and a social worker that everyone who they serve is either in a homeless program, currently homeless, or recently homeless, and they keep them. And the reason that clinic is so beautiful is they are understanding of the homeless reasons. So if someone needs to get in right away, they can usually get them in quicker to see the doc than maybe someone else. They understand these veterans don't have phones. So if they walk in, let's see them. Let's not send them away and expect they're going to get back when they're floating out there homeless. And then we have a social worker that's really her specialty, and she's attached to that homeless primary care clinic to help the veterans. So that clinic is great. Within the last few years, we've also added a piece to that clinic, and that's called our medical mobile unit. VA does have a medical mobile unit. They go out in the community twice a week on the mobile unit to do outreach. They're going out to the parks, so street outreach, and then they're going to our programs. They go to Safe Harbor, and they're going to some of our programs we're contracted with just to make sure everyone there is wrapped with primary care. They'll give flu vaccines. So it's a fairly new service, and it's definitely a great addition to VA and VA homeless programs. I talked a lot about the homeless hotline. So we have the hotline. The other thing we have are called homeless consults. So we have a screening anytime someone walks in VA to see a medical doctor. There's a series of screening questions. And one of the questions is, are you homeless or concerned about homelessness? And if they say yes, that triggers a referral to our homeless social workers. So, we hope anyone that's walking through the doors we're capturing. Veteran justice outreach. This is definitely a unique piece under the homeless umbrella. And they don't have to be homeless to be a piece of this, but we notice sometimes it overlaps. Veteran justice outreach is social workers that go into the jails and the courts to identify persons who are incarcerated and also a veteran, and they're the linkage to VA. Next slide. So this is just a snapshot. I won't go through, all of these, but this is just a snapshot of all of the programs we have, and it does show our programs even outside of this county, but within the county is St. Vincent de Paul, Homeless Empowerment Project, and then Bradenton and Charlotte, we have programs. Our most unique program is the Safe Haven run by Boley in Seminole, Florida. And the reason it's so unique, they do get their individual rooms. They have lower barriers. So if a veteran is active in their addiction, they try to work with them and they're not asking them to leave. It's not like a 3 strikes and you're out. And then our other very unique program, which is also a couple years new, is amazing. And it's called the CARE Medical Respite Program. That program is a program, just as it sounds, for people needing medical respite. A lot of times we're taking people out of hospital discharges into there. It's 5 beds. It's actually run out of a home in Pinellas Park, Florida, and it's run by nurses. There's actually a nurse there 24 hours to help people. So anyone with wound care, PT needs, going through cancer treatment, that our other shelters really don't have the staffing or the bandwidth or medical expertise, honestly, to handle, we place them in these medical respite beds. Next slide. These slides go very specifically through the programs. Almost all of our programs accept both males and females. When I first started at VA, it's been almost 14 years ago now, they did not all accept females. So we have come leaps and bounds with really adding females to our contracts and our grant and per diems. Most of the length of stay of our shelter contracts is 30 days. We do give extensions if people are doing what they're supposed to be doing and meeting their goals, and they just need a little longer length of stay. And you can flip to the next one. This one gets 90 days. This is located at Homeless Empowerment Project. The reason we give them a little longer, you have to have a serious chronic mental illness to go here. Not all of our programs have criteria. You can just have fallen upon hard times and maybe you don't have a mental health diagnosis, a medical diagnosis, and you can still go to like St. Vincent de Paul. But for this particular program, you do have to have a serious chronic mental illness. And because of that, we do allow 90 days. We like them to be able to get in there and get acclimated and get, do what they need to do before moving them on. Next slide. This I talked about already. This is our BOLI Safe Haven program. Like I said, very unique program, low demand environment. They are allowed 6 months to stay. BOLI does a great job. They really take our most difficult to reach veterans, those that are chronically homeless, that have been in and out of homelessness. Maybe they're banned from other programs, and BOLI does a great job at bringing them in. Next slide. This is our medical respite program. Another one, you get a little longer length of stay, 90 days, and I talked a lot about that. I'm noticing the bullet on here, no income and no charge. None of our shelter programs besides BOLI do have income limit or do have income limits or charges. So sometimes we will see a veteran with high income. Maybe they're getting VA disability plus Social Security. We can take them into our shelter programs. BOLI does follow HUD guidelines. So the income is a little lower to get into BOLI, and there is a program fee there, which gets them used to being out in the real world and paying fees. Next slide. This is our points of contact. There's, like I said, a liaison attached to each program, my information. Next slide. This is the program I talked about, our residential treatment program that's on site here. One of our very few on site that will also serve homeless, but they do provide that short-term residential stability. They must be stable. If their primary diagnosis is substance treatment, we'll put them in the substance treatment program first and then over to here. And they must have rehab goals, be willing to attend groups. And like I said, that's located here at Bay Pines. Next slide. Our grant and per diem programs, this is the one, like I said, where our partners will write grants, and then we'll provide the grant money so that they can provide the program. We do give a 3 to 6 month length of stay in our grant and per diem. So often these are our veterans who need a little more wraparound, a little more time. Maybe their income's low. And each grant has its own model. So meaning some serve those with clinical needs, some serve those we call low demand model, those that are coming in and out of homelessness. We have a bridge housing model. Those are the ones who are wrapped with a housing intervention, like maybe they have HUD-VASH in place. Next slide. And this is a snapshot of all of our grant and per diem programs. Again, all partnerships in the community. I'm sure all names you all have seen. Next slide. This is our points of contact and grant and per diem. Next slide. So HUD-VASH, and I know I'm getting short on time. I'll try to go through this quickly. Apologies. So HUD-VASH is a partnership between HUD and VA. The VASH stands for VA supported housing. So HUD provides the voucher just as a non-HUD-VASH, like a regular Section 8 person would have. VA provides the case management, and it is intensive case management. Next slide. So they do serve the most chronically homeless and vulnerable veterans. They really try to focus on those that have a really high case management needs. Sometimes the case managers are out there weekly. If they don't have as much case management need, we're out there monthly. Next slide. We do use a housing first approach. I thought about, should I take this slide out? Because I know nationally this is kind of changing, but as of right now, VA is still serving those in HUD-VASH with a housing first approach, meaning we're prioritizing getting them into the home. And then if we need to wrap services around them, such as mental health treatment, substance abuse treatment, we will. But all we're asking is that they agree to case management from a HUD-VASH social worker, not intensive treatment, to be in the program or be housed. We believe that stable housing is a fundamental right. Next slide. So this is really interesting. I just want to spend a little bit of time on this slide. You do not have to be eligible for health care to be eligible for all of our homeless programs. So our contract shelters, those are the first few programs I talked about, the shorter length of stay, you do have to be medically eligible. Our grant and per diems, which is the transitional housing that they get 3 to 6 months, and our HUD-VASH, you can be what VA calls humanitarian, meaning if you have an other than honorable discharge, you still qualify. Dishonorable, no. We also recently expanded to take those that served in the reserves. We used to not take anyone that served in the reserves. So this has really expanded the provision of services to veterans out there. And I always say, like, even I am not an eligibility expert. I lean on someone every day in our eligibility department with questions. So if you encounter someone in the community and there's question, are they not? I always say, encourage someone to go to VA. There's people that think they're not eligible and they absolutely are. So encourage them to go to VA and check out their eligibility, both for healthcare and homeless programs. Next slide. This just kind of goes through what I just went through, and I'll fly through it because, again, I know I'm getting short on time or over my time. Next slide. And this goes through the same thing. The HUD-VASH program does not take sex offenders, and that's a HUD rule. Next slide. So HUD-VASH has a multidisciplinary healthcare team. It's not just the social workers. There's actually a psychiatrist, a substance abuse specialist, and an employment specialist, and then a peer support. Often the peer support is a formerly homeless veteran or a veteran who maybe had previous substance abuse issues or mental health issues and really can relate and go out there and visit the veterans. Next slide. One team approach, I've talked about this already a lot. We work really closely with our community to meet the goal. We can't do this alone. Another partner that I didn't talk a lot about is SSVF, St. Vincent de Paul Supportive Service for Veteran Families. They run rapid rehousing programs for VA. We lean heavily on them and couldn't do our work without them. Next slide. This is the referral process. If you guys ever encountered anyone, honestly, probably the best thing, and I think I saw someone ask it about my contact. I'll throw my contact in the chat. The best thing, if you guys in the community encounter someone homeless, have them call me or this outreach line right here, this 17005, and I'll put them both in the chat once the next person gets up there. And then, like I said, we also have a walk-in clinic. So if you need to drive someone here, they can walk in and see somebody. And then our call center numbers on there. Next slide. And this just talks about our SSVF partnership, which I went through. Like I said, we have an employment specialist under our umbrella that tries to help those in our homeless program get employment. Next slide. And here's my contact information again. So if you guys want to take a screenshot of that, and like I said, I'll throw it in the slide. And that is it. I know there's going to be a Q&A, so I will definitely hit all those questions, and I can answer them in the chat too. Thank you, guys.
Thank you so much, Blossom. That was great information. Next we have William Atkinson from Recovery Epicenter Foundation. William is the executive director and co-founder. The foundation's mission is to remove barriers to sustainable recovery through diverse peer-to-peer support services for individuals in recovery, their families, and the community. Thank you for being here, William. Go on and begin whenever you're ready.
Thank you so much. It's a privilege to be here with you all. Hi, my name's Will. I'm a person in long-term recovery. As this first slide says, we are out there providing Narcan distribution, housing and secure support food security support, peer respite care, collegiate recovery programs, peer support trainings, recovery roundtables, recovery cafe network. That's coming soon, as well as Florida Association of Recovery Residents Housing Development. Next slide, please. Just a little bit of history. We started in 2014, just a group of people in recovery who wanted to improve just standards throughout the area of how people, we like to call it recovery infrastructure. Um, we got our 501c3, started distributing Narcan, et cetera. We survived pretty much entirely just off of donations from local recovery residences. And we're lucky enough to be recognized in 2017 as an RCO by the Faces and Voices of Recovery, a national organization. Um, in 2019, we started expanding services by distributing Narcan and doing recovery coach trainings in Pasco while continuing to provide services in Pinellas. Right at the end of COVID, because everything kind of slowed down for about a year and a half with COVID. We were very grateful and are still very grateful to have a subcontract with Central Florida Behavioral Health Network to provide originally direct peer support work as well as outreach for the community. And it it's been incredible getting to connect with our housing insecure people where they are, as well as making sure that Narcan is distributed, throughout the areas that we serve, and watching as the number of overdoses, while continuing to rise, the number of deaths diminishing in our area. So we're really proud of that effort. Next slide, please. Um, I'm assuming you all know about Narcan. If you don't, it is not enabling anyone to use. It is just keeping them alive long enough for them to hear a message of recovery. We've done a number of programs and outreaches around Narcan, and would be happy to come out and do training and deliver Narcan to you or your organization. Um, I we have quite a lot of Narcan on site, and we're going to keep on getting it out into the community. Next slide, please. So since 2022, we've been doing monthly outreaches in Pinellas and Pasco to the direct encampments. We work closely with both Largo and Clearwater officers, police officers, in helping those encampments that are found connect with peer support work, as well as getting them linked to continuum of care services throughout the area. Next slide, please. Through numerous funders and supporters, and this is kind of we've watched the overdoses continue to rise, and now they are finally starting to drop. A lot of work still left to be done. No celebration is warranted, but it is encouraging to see lives saved. Next slide, please. So we have kind of an overall, hope and belief in how recovery can continue to grow throughout our area. We really believe in harm reduction, housing first models. We also believe that abstinence-based recovery can coincide with housing first models. So we blend that with our peer respite centers, which I'm going to get into, as well as through how we engage with the community. And as we know, when we have, some mental health and substance use disorder treatment, housing, and employment connected with just basic community, we see a lot better outcomes than when we're missing any one piece of that. So we feel there's a lot of work to be done, and we're out there doing it. Next slide, please. So what is a peer respite center? I had the absolute privilege of presenting at Safe Harbor back in 2020, early 2022, no, mid 2022, with Lieutenant Haish and Perk and Baycare and Westcare. Uh, I was of the hope that we could convert some spaces in Safe Harbor to directly work with peers and getting the individuals who want recovery connected to services, and very understandably was told we can't give up those beds. But I had the privilege from that meeting of meeting a gentleman, Sam Picard with Baycare, who saw the importance of what we were presenting. And Sam and Baycare awarded us a 3-year grant, which started in March of 2023 for us to open the region's first non-medical and non-clinical peer support respite center. Since opening, we've had the privilege of working with over 1,000 citizens and connecting them to recovery community services, transitional living, higher levels of care, uh, back to their families with about a 5% rate of being unable to help them stabilize. So I'll just read off the peer respite is a home-like residence that provides 24/7 monitoring by peers with lived experience, short-term housing, and transitional support for people suffering from a substance use disorder that do not meet the medical threshold for care required for emergency services and do not have the means to check themselves into a private detox. We've found that to be a real gap in the continuum of care, is that we have people who are uh, in need of help, but who haven't been able to access it through the traditional means. Next slide, please. So the whole idea is the supporting of transitions. It's not you need to meet this particular criteria to come in. It's you need to let us know that you need help and what, here's the help that we're able to provide, which is connection to these higher levels of care, transitional living, or just somewhere that they can actively sleep it off, because a lot of recovery and substance use programs are geared towards abstinence. We are in time, but nobody needs to come in completely abstinent, nor do they need to come in meeting like an emergency level of care or having used in the last 24 hours or any of that. It's just if you say you need help, we're willing to help you get connected if we have a bed. So being released from jail, anything. Next slide, please. Peer respite services diminishes the losses experienced in transitions between programs with enough saturation. We will eliminate the waiting list for medical detoxes, the overcrowding of emergency rooms, and a large portion of the homeless population throughout the Tampa Bay region. We have a process in the substance use disorder field of passing people to the next stage. The peer respite is a safe space that someone can go in those transitions. Whether you're coming right off the street or you've already been stabilized and you're waiting for a bed in the next space, or you return to active use and you need, the opportunity to get reconnected. Next slide, please. So since 2023, this is by year, we served 266 people in the first year, an average length of stay of 8.5 days. 62 of them were connected to a higher level of care, and 154 of them were connected to transitional living. The remaining 20%, 15% were connected to their own homes or families, and 5% were referred out to shelters because we weren't able to get them placed. Next slide, please. 2024, we served 549 participants with an average length of stay of 7 days or 7.5 days, with 99 participants getting connected to higher levels of care and 320 people being linked to a recovery residence. Next slide, please. And this is just up until June 30th of this year. I haven't updated this slide. I apologize. We had already served 318. This is well over 500 at this point. Average length of stay was 8.3, with 91 getting connected to a higher level of care and 158 to recovery residence. Next slide. Because of the availability of peer respite centers, 973 people received short-term emergency housing with over 1,000 admissions and a 30% readmission rate. Let me be clear. We are not necessarily attempting to make sure that someone stays sober for the long haul. We are making sure that they have a safe space to return to if they do return to active use. 632 people were connected with long-term recovery housing. 252 people were connected with a higher level of care. Only 56 people in 3 years were unable or unwilling to abide by peer respite guidelines and were discharged due to behavior and/or active use. And only 193 admissions were not connected to the continuum of care while at the peer respite center, and many of them returned and were connected later. Next slide. Why are the peer respite centers essentially continuum of care? Next slide. Every time a person with a substance use disorder returns to active use, they're playing a deadly game of Russian roulette, and we have way too many just barriers to access to care. Peer respite is a space where someone can come for free, be surrounded by people in recovery, and get reconnected. Next slide. Peer respite centers could be even more effective than they already are. It's more of a just by providing scholarship opportunities for people who otherwise don't have the means, by connecting them with more transportation options. We have a really great connection with PSTA, and they go out of their way to provide day bus passes, but more transportation services are always needed for our residents. As well as peer support specialists who could work with individuals on a daily basis throughout the community, not just at the controlled setting of a peer respite. Next slide. Yeah. We're continuing to actively build towards that recovery infrastructure throughout the area. Next slide. And we're doing that through recovery roundtables, peer support trainings, collegiate recovery programs, FAR housing accreditation support and training. And we're really excited that in the upcoming year, we're partnering with the Good Samaritan Church. And in the shadow of Tropicana Field, we are opening up a recovery community center and cafe at 1940 Central Avenue in downtown St. Pete. Where kind of as a drop-in center, people can come and get connected to all of the services that we provide, as well as all of the partners that we work with. Next slide. These are all just essentially more information about the services that we provide for outreach. Next slide. We're out there actively training peers in the area. Next slide. As well as super excited to work with St. Pete College and Eckerd College on providing peer support for their students, as well as encouraging recovery support on the campus. Next slide. And we're going to be launching for Hillsborough, but has nothing to do with Pinellas. So next slide. And as we mentioned, the beloved Recovery Cafe at 1940 Central Avenue. Opening up in the next year. Next slide. That's it. We really appreciate your time and being a part of this community. If you have any questions, we'd be happy to answer. And please feel free to reach out to us. Thank you for your time.
Thank you so much, William. And that was a lot of really encouraging information. I'm really excited to see and hear that your program, it sounds like, fills in a lot of the gaps that other programs may not. So I really appreciate you coming here tonight and talking to us about everything you do and everything that you are going to continue to do for the community. So thank you very much. Next is going to be Miss Dominique Randall, and she is from Pinellas County Human Services Department. Dominique is in the homeless section, is the homeless section manager. She oversees homeless related services and funding throughout all of Pinellas County. Thank you for being here tonight, Dominique. You can go on and continue whenever you're ready.
Absolutely. Hi, everyone. As many of you know, my name is Dominique Randall, and I was asked specifically today to talk about the healthcare program offered from Pinellas County. So we're going to get into the Pinellas County Health Program as well as our healthcare for the homeless program. If you'll go to the next and next. So we're going to talk a little bit about what the programs are and then the eligibility for them. So as you can see on this slide, what we're talking about first is going to be the Pinellas County Health Program. This is actually for anyone who it's providing a medical home for those who are uninsured or underinsured in our community that are 18 to 24 years old. The reason why it is limited to that 18 to 24 years old is because there may be other insurance available for those outside, for minors and those that are seniors in our community. It's focused on preventative care. So it's not the emergent, the minute clinic, the ailment. It is intended to be a true medical home, meaning you're going there for full maintenance and preventative care. And of course, there is going to be the occasional issue that may arise and the emergent needs that come up, but ideally focus on the preventative care, disease management, and primary care. So again, focus shifting from that reactive sick care to the more long-term wellness and prevention. Next slide. So eligibility for this to those in our community that are underinsured or unable to pay for other medical care. The Pinellas County Health Program is specifically for, includes those who are housed, for those that are below 100% FPL, thorough poverty level, which is about 16,000 annually or 1,300 monthly. So if people are making less than that a month, they qualify for the Pinellas County Health Program. They do have to be a Pinellas County resident, as it is part of a perk of the county, as well as be asset limited, meaning they don't have, own a home or have some large cash within their bank account or something like that. The program is good for a year, and of course, there's opportunity to auto renew. If it's for those who are underinsured or not insured. So if they're eligible for some other program, then we're going to help link them and prioritize them to there. I wanted to focus on this picture for just one moment. This is a picture of the dental clinic. You'll see a few pictures as we go through these slides of what the actual facilities look like. And I included those because a lot of people have this perception of what, say, a free clinic or reduced or an indigent care clinic will look like. And I really just wanted to show that it really is. Honestly, the Bayside Clinic has been renovated within the past year and a half, and they're just beautiful facilities, really intended, again, for that healthcare is healthcare, and that holistic approach to service. Accessing services for this program is actually through any of our Department of Health locations. So you see there's one in Tarpon, Clearwater, Largo, Pinellas Park, and St. Pete. Again, the income is around $1,300 a month, and the assets are limited at about $3,000 for an individual. So again, if they have a lot of income, if they have a lot of assets available to them, we're going to probably connect them to the care network or some other services that they may be eligible for. Next, we have the Healthcare for the Homeless program. If you'll go to the next slide, please. And this is really the majority of the program. And people think about the Healthcare for the Homeless, Pinellas County Health Plan. Sometimes people call it the Blue Card, not Florida Blue, but it used to be, and it is an actual blue card for those that are issued and part of this program. But what the Healthcare for the Homeless program does is it provides medical, dental, behavioral health, and case management to persons that are experiencing homelessness across our community. Again, the difference between this is it's provided by Pinellas County Human Services and Department of Health, and it is federally supported, and we do qualify as a federally qualified health center, excuse me. And again, it's focused on accessing services in our community. Healthcare for the Homeless program, if you go to the next slide, provides that primary medical care. Again, it's not the sick call, it's the wellness call and the preventative call. It's the health maintenance and working on really the holistic approach to the person. The eligibility for this is much easier. proof of homelessness, which can be a shelter letter, a self-referral, honestly, a letter from if you're getting mail at a local facility or Daystar or something like that. Again, they have to be within that 18 to 64 range and either be low income or there is a sliding scale for those with more income, and that is even negotiable. Where no one is going to be denied based off their level or ability to pay or not pay. Accessing these services, again, you can see some pictures of the clinic and some of the changes that have happened over recent years. If to apply for the Healthcare for the Homeless program, individuals are encouraged to either visit the MMU, which is a mobile medical unit. That is a large, I say bloodmobile style, very large bus that goes around and actually is parked at different places across the community. Or they can go to the Bayside Clinic, which is right next to Pinellas County Safe Harbor. That was intentional. There's obviously a lot of unhoused individuals that are accessing and coming through Pinellas County Safe Harbor. So being right next door, the idea was to help potentially reduce the burden for medical needs at Safe Harbor and have that accessibility on bus routes, and so accessible to some of the other services in the area. You see the hours here. We are again trying to talk about that accessibility. Hours are 8 to 8. Friday 8 to 5, and Saturday hours. How many of your primary care and dental services have that kind of extended hours? Mine do not. Just to give you an idea, there were over 1,400 visits, unique visits and unique individuals, I should say, over almost 4,000 services that have been done out of this clinic year to year. That is an increase from the past few years. Of course, with COVID and the impact of COVID, there was a lot of reduction of services. We've tried to kind of modify that, like I said, with the mobile med unit, which is the large bus that is traveling around, the expansion of the clinic there was one chair for dental service up to 3 chairs now. And we also offer telehealth. Telehealth is not available for your initial visit, but it is available for any of the maintenance or sick or follow-up appointments. So to establish care, they do have to come in person. And of course, if there's any labs at work or anything specific like that required, those may require in-person visits. But some of that maintenance, say they're working on diabetes or heart or healthcare, women's health, some of those appointments can be done virtually, depending on the need, which obviously makes it accessible throughout the entire county. There's also some limited tablets across the community and access points where people can access those telehealth appointments. But honestly, we have found that most people have access to technology for these telehealth appointments, whether that be a phone call or video conferencing. Also at the Bayside Clinic, we have Bay Area Legal Services, Directions for Living, Operation PAR, and our disability advocates on site that all provide those services. And we'll get into what the disability advocates do in just a little bit. So I know I mentioned the healthcare for the homeless and the MMU. So there's a picture here of the MMU. And again, and you can see their current schedule. It doesn't change much, but they do spend Mondays at the Clearwater Health Department, Tuesdays in downtown St. Pete, Wednesdays at Pinellas Hope, Thursdays at Salvation Army. That's the ARC, which is, I kind of call it West St. Pete, but that's 66th Street. And then they're at Salvation Army in South St. Pete. And again, that's strategic because we're looking at where are the Department of Health sites, where's the Bayside Clinic, where are these different access points, and where are we going to have a big return, a big interest of people coming and going. Our street medicine team is a newer addition that we've been able to add. And they are more mobile. So they are more responsive and they are more canvassing. So they are in a kind of like an Amazon Sprinter van, the smaller vehicles. And so they're going anywhere from Tarpon Springs, Clearwater, St. Pete, Largo, anywhere really that if they've been told someone's in that area, they're going to try and canvass. So they're doing the parks, and then we talked about the peer recovery centers. They're going to Catcher's Mitt and some of the churches for meal sites and all of those sort of things. So both of these eligibilities, so if they're housed less than 100% federal poverty level, if they're unhoused, there's no income limit and the eligibility is much easier. There's no documentation other than proof of homelessness. All of these things are covering essentially the same services. And again, preventative wellness care. So those annual physicals, the lab work, right? To determine if there's other kind of more pervasive needs that may exist. Mental health services and substance use services are also available by referral. I mentioned Directions for Living and Operation PAR. Dental services are available on site. And that's the picture I showed you earlier with the three lab chairs, or excuse me, with the three chairs. And they also work with the lab work, diagnostic imaging, testing, all of that. There's actually been a really big increase in people getting lab work that was needed for mammograms and for men's health, women's health, and all of those sort of things over the past few years. We're doing a lot of work in diabetes prevention and reduction, blood pressure, a lot of those sort of things that you wouldn't necessarily think of, again, when you're reacting to an issue, but more being in that preventative state. Case management is also available. One of the perks of this program, too, is that it makes you eligible for a discounted bus pass. That bus pass is reduced down to $6 monthly. As many of you know, the city of St. Pete has a similar program where they actually cover 100% of the cost if the person is a resident of the city of St. Pete and meets the eligibility criteria. But the county healthcare for the homeless program makes it $6 a month. And so I think it's still $88 or so. So obviously a big reduction in savings there. They do have to have one appointment before they can get that perk activated, but that is a nice perk. Scripts are also available across the entire county. Again, better than my own insurance. Publix, Walgreens, Walmart, CVS, and a lot of private mom and pop type prescription coverage across the entire county. And there's even prescription delivery. There are some dedicated case management available for what's called disability advocates. If anyone is familiar with SOAR, it is similar to that, where it is a disability advocate that is identifying whether this person meets the eligibility for receiving Social Security disability benefits. If so, they're working on their case at no cost. You have to be a healthcare for the homeless participant enrolled in the program to receive this program, this service. They do orientations over at Bayside and also one-on-one by reaching out. I've attached a QR code, or you can call the main office to get more information. They're not going to waste people's time. They're going to know whether you have a case or not and say, yep, let's take it on and we'll work for you. There's no cost to it. So I highly, highly encourage people to use this versus some of your private legal programs that may get a percent of your award, may delay your award, so they get a larger percent. There's a lot that goes in, or I may have too many clients, honestly, that they're working with to really advocate for the unique individual. But that is available. They have a very high rate of success as well in getting people the services they need. How to apply. I've linked the QR code as well as the web address. I'll be honest with you, the website isn't pretty. It is in need of a major upgrade, but it is easy to log into. You can also go down in person to the St. Pete offices, any of the MMU sites, as well as the Bayside Clinic, which I showed in the previous slides. But this is where the St. Pete office is. It's right on Mirror Lake in downtown St. Pete and available for people to enroll and register. And you can also do it all online. Again, if you are housed, there's going to be some documents required for eligibility. Unhoused, just proof of homelessness. I did want to just mention quickly that right now we do have a healthcare evaluation that is going on just to kind of assess the program as a whole. If you'll go to the next slide, please. Just assessing our comprehensive primary care and support services, identifying any gaps as well across our county, the effectiveness and the efficiency of programs. That is something that is happening in the spring. We hope to have results by April or May. So that may enhance our services in the going forward. But in summary, next slide. This one got a little wonky, but in summary, again, Pinellas County Health Program and Healthcare for the Homeless are really there to provide essential healthcare services for the uninsured and homeless adults in our community. That includes primary, dental, mental health case management, and preventative substance use as well, helping to reduce barriers through mobile telehealth, clinic-based, multi-site locations, expanded hours, and really strive to strengthen the public health while supporting community stability. And that really just kind of enhances the other services that Pinellas County offers through our shelter support, through prevention, rapid rehousing, permanent supportive housing. Blossom said it earlier, but housing is healthcare. And so as part of that holistic care, identifying and really treating the whole person is really valuable as we continue to serve our community. So thank you so much. I will say I'm not going to be available for the question portion, but please send me any questions you have, and I'll put my contact information in the chat as well. So I just want to thank everybody for your time.
Thank you so much, Dominique. As always, your knowledge is incredibly impressive, and we really appreciate all of your dedication, and we appreciate you being here tonight. Our last presenter that we have on the agenda for the evening is David Hassett, and he is with WestCare Gulf Coast. David is the program manager for WestCare, and WestCare supports individuals at every stage of their recovery. They offer residential and transitional housing, outpatient treatment, workforce training, and supportive services. David, if you would like to go on and continue, you are more than welcome to. And if you would like for me to go on and continue on to the Q&A portion, we can also do that.
Hi, thank you so much. I had a presentation, but I had an issue with, for some reason, it wouldn't send out. So I'm just going to kind of read from the slides that I had. Evening, everybody. I am the program manager for WestCare Gulf Coast Turning Point. I serve WestCare at the A Turning Point. We cover homeless services. We kind of dabble with shelter care, which is generally an immediate receiving services. So we'll take individuals 24 hours of using straight out of the streets, whether they are intoxicated or not. We'll also serve individuals from Safe Harbor, anyone from the hospitals. We get a large inflow typically of individuals that hop between either shelters or the streets, and then by the time they get to us, they've just hit a really bad patch. We are a non-clinical program, which is essentially just means that when they come into us, we do follow a social detox model, which is essentially cold turkey. It's just a fancy word for it. With that model, the first 3 days, you have a bed, they get meals. We do have peer support on site. It provides them a introduction to what they might get for the next 30 days. We are a 30-day program, and after the 30 days, we do an extended stay for up to 120 days to help lower them from a secure shelter setting to either transitional housing or rentals. Typically, those individuals that do step into those 120-day rooms, they are rapid rehousing and or permanent supportive housing referrals. So we provide 65 bed spaces for adult only. We don't do families or children. When they come in after the third day, they'll get case management and continue peer support. That's where we'll really work on getting them screened for HIV, linkage to Hep C treatment or testing. They'll get primary PCP visits while they're on site. We do have the ability to get them documentation ready, whether that's notarizations for certified copies to bypass some birth certificate requirements for Social Security or DMV. Whatever the client generally needs, they'll get that within the first 14 days. By time they are on the 21st day, what something looks like for a client is either returning to work or work that has been put on hold, like some clients will have leave. Individuals that are on Social Security or a little bit older that can't work because they're on disability or trying to wait for the disability, will really work on trying to show them what life looks like after they get their check or have their check. A lot of individuals that are on Social Security will pay all the bills by the first of the month or the third of the month, and then they don't have anything. So staying in that stagnant process sometimes gets boring. It's a trigger for them, so they learn what life looks like without using, but also what life looks like without having a large amount of money because everyone's on subsidized income with that. When clients get to the 30 days, we generally place clients, whether that's in shelter care, which is long-term shelter at that point. We're lowering them out for intervention. Essentially, long-term shelter individuals, we do serve a predominantly higher, older clientele between anywhere from 30 to 60. A lot of those people are individuals that slip through the cracks when they get to us. By the time they get to us, they've already kind of hit their threshold, whether that's too many visits at Safe Harbor or just been out too many times on the streets. So sometimes those individuals that need ALF placement, will link them to areas of aging. We'll get the 1823 form signed. We've had recent success with placing them to an ALF within the 30 days or 45 days, depending on what they have. If the individual does meet ALF but doesn't have the means or denied, we'll link them to Adult Protective Services so they don't stay off the radar for individuals that might be indigent but don't have a phone or any means to kind of advocate for themselves. Health insurance, we do link them with Blue Card. It's a great program. We do use the portal. It's the easiest thing to kind of link them with an email. I know a lot of the population we serve homeless wise, they don't have an email or understand what one is. It's the best alternative you can have digitally because a lot of things, as we all know in this county, PSTA, um, from an organization to another, that's usually tracked with email. So getting them on an email, getting them integrated to know how to access it, we work with that within the first 30 days as well. We do PSTA single day passes. We do utilize the St. Pete residency at Turning Point to get them to 30 days, which we've had recent success. This last month, we did about 50 30-day bus cards for the clients that we served, which is about 90% of the population overall for everyone that was case managed. So with that integration, we've been able to get them a little bit further out for work, job placement, stuff like that. When clients are at Turning Point, which I get asked a lot, it's open form for them between 3 and 11. From 9 to 3 is typically when they're going to be in group. They are provided peer support services 7 days a week on site. A lot of the BHTs that I have, although might not have the title peer support, all the program design was peer support related in the sense of trying to help someone out. Everyone that I have has come from some form of recovery or another, whether it's substance abuse, mental health, losing a child, stuff like that. We have a very diverse population. If you've ever been to Turning Point, you'll know that I have staff there that has been there 27 years. I have staff that are new. The premise of the program is trying to get someone from the ground up. We don't have the key to recovery. We don't treat them based off the labels that they were given. And because of that, that's why we get a really good success rate with the population we serve. The overall goal for Turning Point after their 30 days, if they stay with us, they'll pay 125 to help bridge them to funneling their budget. We usually bridge them to Mustard Seed Inn, which is a FAR accredited facility. They serve about 68 individuals. They also recently opened up a 20-bed space to help with their accommodation for transitional. West Care Golf Coast as well has a MAT team that's integrated within all our programs. So a lot of the clients that come in that need MAT services, will link them directly from Turning Point with a dedicated counselor. If they don't meet Turning Point needs and want services, they are always welcome to engage with our outpatient office. We have outpatient offices throughout the Tampa Bay area, and we're expanding into Hillsborough starting soon. We're also affiliated with Red Tent, which is a trauma-informed program that's integrated with the jails and the courts. And placement outside of where I spoke with clients also have the opportunity to think about life beyond programs and treatment. We have a diverse alumni spanning back from the original members from 2000s all the way to current members, and they host a peer support group internally once a month to help individuals that have graduated the program or in aftercare to stay connected to their roots on why they got clean. And that is my presentation.
Thank you so much. Really, really appreciate that vital information in our community. So thank you for being here tonight, David. We will now begin the question and answer portion of our session. Presenters have been answering questions within the chat, so thank you so much for doing that. If you do have a question, please either put it in the chat, or if you would like to raise your hand and come off of mute to ask your question, please feel free to do so. Any questions for any of our presenters?
Well, if we don't have any questions, I
That
guess
must have meant the presenters did a great job sharing
yes,
such
they
thorough
did.
information.
They
And
did
again,
an awesome job. I just want to thank everyone who participated and thank you to each of the presenters for volunteering their time tonight. They did such a great job. That was just so much insightful and resourceful information. And I'd like everyone to know that all the materials and resources will be posted in the Pinellas CoC website in a couple of days. And if anybody has any additional questions, you can always reach out to us. And that's it for tonight. Thank you so much to everyone. And the meeting is adjourned, and I hope everybody has a great evening. Thank you.